You're watching UNICEF television. In normal times, this is a quiet corner of Beirut University. But in these days of war, it's a place of refuge for the more than 200 families forced to flee the conflict racking South Lebanon. Stranded in these unfamiliar surroundings, the children must find ways to kill time. But to the youngest, there's a much bigger problem. Cramped, unsanitary conditions mean hygiene can be compromised, bringing the real risk of disease.
Whenever you have a high concentration of people living in the same place, is to worry about contagious diseases, especially those diseases that are highly contagious and that can affect children on the short term and the long term. Two of those diseases are measles and polio. And that's why we usually try to vaccinate, a blanket vaccination for all those who are displaced children, for polio under 5 years and for measles from 9 months to 15 years.
For UNICEF's NGO partners, the exercise is a real challenge. The vaccines already stocked at the health ministry are sufficient for the children in the Beirut area. However, ongoing bombings have hampered the immunization drive. Today, the task of reaching every child in the target age group was made more complicated by the destruction done both here in Beirut and on the main land route linking Lebanon to neighboring Syria. Fresh supplies will be needed when the immunization campaign expands to reach displaced children living in other parts of the country. In the meantime, the threat of disease will be added to the dangers facing families who have already suffered too much. This is Sabine Dolan reporting for UNICEF Television. Unite for Children.